Hello, everyone. I'm Priscilla, and today we will be talking about public involvement in research. And today's content for sharing is what is and what isn't public involvement in research. Why is public involvement in research important? And the four principles for meaningful public involvement in research by the NHS HRA, which is the Health Research Authority. We'll talk about the UK standards for public involvement and what is public involvement, public participation, and public engagement. So, what is public involvement in research? I know this platform is more to do with research and nursing. However, public involvement in research cut across the spectrum, whether a nurse researcher, whoever involved in research. And so we would just be, discussing public involvement in research and linking it to research involving, nurses as a whole. So research done with public, that is public involvement in research. The key word is research done with public, by the public. The public are actively involved in the research process. And so when we talk about the research process, we talk about identifying and prioritizing the research topic, the objective, the aim, and all of that, designing and managing when it comes to identifying the methodology, design process, and all of that, funding and commissioning, identifying, grants or funds for the study, who takes what takes what, which goes where, undertaking and analyzing when it comes to, analyzing the data, disseminating the information, translating the information into practice, or talk about implementation, evaluating the impact after you have, used the findings in your clinical practice. You then evaluate the impact to assess or ascertain whether whatever you did really made an impact. And so with these processes or cycle, when it comes to public involvement in research, it means that the public is actively involved in these stages. It might not necessarily be all the stages, but definitely there is some kind of active involvement where they are part of decision making, where they are part of data collection, where they are part of, giving their views on how, a public information sheet is laid out, or even how to approach the participants. That is what we mean by public involvement in research. There are different forms of public involvement in research. We've got co-production, collaboration, and all of that. But the key word is active involvement in the research process. Um, Active partners in the research process. I think I've explained that already. Public includes patients, stakeholders, health professionals, or anyone who uses health and social care service. So when I talk about public on this platform, I do not mean patients only. It could be anybody, a stakeholder, a governor, anyone using the health and social care service. Okay. Public involvement basically refers to people with relevant experience being actively involved. So, whichever study you're undertaking, the public involved in that study means that they have that kind of experience with regards to the study being undertaken. They have some kind of an experience the researcher might necessarily not have. Some people, decide to undertake studies based on what they've been through, the kind of experiences they've had. But most of the time, researchers don't really have the conditions they experience. Sorry, the conditions they're researching, and so identifying the public who have got that relevant experience or lived experience, and involving them is what public involvement in research basically means. So in this instance, they contribute to the research designing, they contribute to the research conduction, and they contribute to the dissemination. Yeah. So What is not public involvement in research? So we talked about what is, now we're going to talk about what is not. It doesn't mean public involvement in research does not mean research done to the public. So you're not just delivering the research to the public, you're doing your own thing and then delivering it to the public. So you do your own, from maybe identifying the topic, identifying the objective, or maybe the hypothesis, and proving the hypothesis, and identifying one or two, three participants undertaking your study, and then that ends it. And then you sit down, analyze with some few statisticians or experts, and then you write everything down, you publish it in the journals, you submit it for conferences or maybe share it during conferences, and that is it. No, that is not public involvement in research. Public involvement, like I said, remember, actively involving the patient or the public in the research process. They are part of the decision making. So the research is not done to them, the research is not done for them, it's not just done about them. All these three things definitely are research, but public involvement in research are not these three. Yeah. So we should try and refrain from these by actively involving the public in the research. And in that way, we will definitely be doing good research. And we'll talk a bit more about how we can do quality or good research by actively involving the public in the research. Use of people as subjects of research. So, like I said, I mean, you've done your everything and you identifying some one, two, three participants as subjects, and you use them for the view, and that's it. Do your own stuff and then publish it. Obviously, that's not what we're looking for. Quality research involves actively involving the public in the research process. Research participation. So research participation and research engagement are not necessarily bad, but then they are part of the public involvement in research, but they do not mean public involvement in research. Public involvement in research is more than just getting some few participants to be a part of the research. They may be part, but they are passively part of the research. They have no say in how the research is conducted or whatever. And that is not public involvement in research. We want them to be actively involved. Their voice is heard from the beginning to the end on how the research is being done. Research engagement is more to do with sharing of the information between the public and the researcher. So that it's good, we have to share, but it is just a bit of it. We want the whole, benefit of it. And that's the reason why we encourage in public involvement in research, which is more than just sharing. We want them actively involved. So, why is public involvement in research important? So, remember, when it comes to public um, involvement in research, it considers all the aspects of the research project. Remember that. Okay, and it's not just a project, it could be a research organization, a funding committee, a research ethics committee. These organizations involve the public because their views are important to be able to identify loopholes with which the science community might not be able to detect because we don't have that experience that these public or the patients do have. So patients are involved in the surveys, interviews, or focus group to provide views on the research topic, research question, method, and the resources available. Most of the time in the hospitals, we've got the advisory board where researchers come and then they deliver their studies, and then the advisory board will kind of identify some few loopholes with regards to the study and all of that. It is part of public involvement in research, but public involvement in research is not just that. It is actively involving the patients or the public from the start to the beginning. From at any point or any phase of the research process, but in this case, they are actively involved. Okay, so it improves health and well being. And the reason why improves health and well-being is because by actively involving them, you get their view, and based on the view or the experience on how the study should be conducted and everything, you're able to do your research. For example, if you're looking for funding for your project, and most of the funding organizations in the UK will definitely ask for how the public was involved in the study. And if there is no evidence on how the public was involved in the study, even from the start, sometimes it might be a very good study, the concept might be good, but then you might not get the funding because you lack that kind of important bit of the research trajectory. And so you might not get the funding, you might not be able to go through ethics to be able to undertake your study. And by that, it means the study, which may be the concept, which may be a very good concept or a good idea or good therapy or whatever it is, might not be able to be carried out because of that aspect. And so if you get people involved, and you're able to prove to these committees or to be able to, use them with regards to the phases of the research process, you can prove that you can be able to undertake your study. And by doing the study, the findings could contribute to the care of which the patient, the public will benefit. It could be a public health arena, it could be in community, it could be in a clinical setting. The findings would definitely would translate into the care. And mind you, because you involve the people from the start, it makes dissemination very good because people they feel part of it, and it makes taking up, or it makes translation of the research result also quite people are willing to use the findings because they felt part of it. So then whatever the treatment is, people will then be willing to be part of it, and they use it, and the results can help with policies and stuff, and that could improve health and well-being. Improve quality of care is the same scenario. So in the health setting, as nurses, if we do involve the public in our studies on the units with regards to the care we give to our patients. For example, you've got a patient on a ventricular assist device, and trying to you're planning on undertaking a study to kind of get the experience of having been in the hospital for a long time on that mechanical device. Obviously, by involving them, they are part of it, and they're able to share, they give every information out. They're able to really understand, the experience, and using that experience, you can be able to conduct, the way you work around them with regards to your care. It will inform your practice. It will transform the way you see things with regards to the care you give them, and that could improve the quality of care you give them. Most of the time, patients are not looking for just medications or treatment or whatever. Sometimes all they're looking for is that touch of love, compassion, empathy, and that could be all they need actually. And that could actually inform the quality of that comprehensive care we plan on giving to our patients. Better research study. So the reason why public involvement in research helps with undertaking quality study is because the in the way with which the study is designed, um, these public, when they're involved in the way in which the study is designed, it makes it acceptable to them. Yeah, it makes it acceptable to them. And with a patient information sheet, if you involve the public, sometimes they'll be, most of the time, they will help you fish out some of the things that could seem of as being insensitive to the public with which you'll be sharing for participation. And so it makes, the public receptive to your study. And it makes it understandable, because some of the time we're using big jargons and stuff, but then when you present it to, if the public are involved, they will be able to fish these things out, and you'll be able to kind of reform it and make it a bit more understandable to whoever you plan on giving it to. It provides a better experience of the research. There have been times where participants have felt like guinea pigs and all of that. And so when you involve people, you treat them well, there is that kind of good relationship, good communication. The participant or the public feel, part of that community. The experience is better. So next time, when you go back to them for new studies, they are willing to be part of it, and it helps you, the researcher, honestly. The public involvement, most of the time, I would say the researcher benefits. In as much as the patients or the public benefit, the researcher benefit. It will cut a lot of cost. It will cut down on the struggles of trying to find, participants for your study. It will even help give perspective into the study, which you might not have had it not been the public being involved in it. Okay. Remember, there is mutual learning and benefit, because there is sharing of information. You as an expert, in the field, the scientist, you've got that knowledge, but then they have got the experience which you don't have. They've got that perspective which you don't have. And so by sharing that kind of back and forth communication between, the two parties, there is mutual learning, and then each benefit from that as well. So there are four principles of meaning research. Before I move on to this, I just want to say that you do not need ethics. You do not need to go through ethics when it comes to patient involvement in research. Identifying a section of the participants with lived experience to help you through the research process. You don't need ethics, but you definitely need consent. You don't want the participant to, feel like they're being exploited. And so you definitely have got to get their consent. There must be some kind of respect. There must be respect among the factions, sorry, among the parties, so that, everybody's view is respected. There must be rules most of the time when it comes to the co-production, which is an intense form of the public involvement in research, where the public is they are the research. Okay, that it's when they are the co-investigators, okay, from the beginning to the end. Okay, there must be rules. Communication must really be strong. Who does what does what. Sometimes you might have to recruit some of the public to, lead interviews or lead, meetings on staff. Sometimes when it comes to financial, and most of the time these public, they've got experience in other areas, even though they might have that lived experience in the condition you are, researching about. They might have got some experience maybe in finance, in medicine or something, and sometimes they bring these experiences, these knowledge, even to the research, not necessarily providing that experience, but sometimes it's more than that. And using that kind of, working with them, I wouldn't want to use the word to make it look like exploit, but working with them, mutual respect, setting objective that reciprocates benefit, and being the flexibility for them to be able to work around, their chores, to be able to also be able to deliver is very important. Okay, and most of the time you don't really have to tell them about the amount, the amount of projects or the amount of money you're using for the research. It depends on their involvement, the extent of their involvement. So all these things need to be factored in place. And you definitely, apart from the public, you definitely need the research and development team in whichever setup you find yourself in to be able to help you through as well. So involve the right people. I'm going to start there. Involve the right people. Involve the right people. If you're doing a study about COPD patients, involve patients who've got COPD. They've got the lived experience. And when you involve in the right people, identify their strengths and weaknesses, and utilize these weaknesses and strength in the capacity to favor the study. Okay. So if they are shy and there's a certain way of delivering that helps them to deliver, obviously there should be some form of accommodation to be able to accommodate that kind of weakness, for them to be able to come out with whatever their strength is to be able to deliver. Okay, so if it's to do with self confidence, what can you do? If it's financial, do they need a voucher for transportation to be able to get to a meeting? Involve the right people, identify their strength, and utilize these strengths and weaknesses in the best possible way. Involve enough people. Obviously, involving enough people means that you broaden the horizon, the perspective differ, there is diversity. You were able to capture and understand the or be able to get a wider scope of experience and perspective about whatever you're investigating in. And so involving enough people is very important. Involve those people enough. So if you have identified the COPD patient, there should be enough to be able to be able to offer what they have to. So if you, like I said, COPD patient, you just two people, obviously that might not be enough to be able to offer you the kind of perspective you need with regards to the study you're undertaking. Describe how it helps. So for most of these funding agency, they definitely would want a proof of how the patient or the public were involved in the study. So you need to think about that. How is that involvement really making an impact in the study itself? So that's something we you need to think about as well. So these are the principles for the meaningful research. UK standards for public involvement. So there are quite a number of them. There are six of them, and this is set up by the I think the UK standards for public involvement, and we'll talk about each of them briefly. So the first one, which is working together. So working together means that you're creating an environment where there's a mutual respect, productive relationship, that all values and contributions are respected. Okay, so you do not want the participant to feel that they are being exploited. You're here just because you want to because we need your input, and that's it. No, they need to feel like they are part of the community, they need to feel like they are part of the family. And the last thing you want is to make them feel like they're here for that, you're using them, and that's it. No, they need to be part of that. They need to feel that. And you, as the researcher, you need to be able to make that happen. And in that way, you'll be able to get the best out of them or the best from them. Communication. I said communication is very important. Who is doing what? When is what happening? What is happening? Feedback, when you're discussing stuff with them as a scientist, you might have to come down at their level. Always get the feedback from them to identify ways to kind of improve when it comes to communication flow with you all, and and all of that. Okay, so communication is very, very important. Use plain language. Okay, when it comes to activities and plans and everything, so that the fluidity of the whole project or whatever involvement whichever way they're involved in, becomes a bit more, you know, fair. So the next one we go to inclusive opportunity. So inclusive opportunity is more to do with partnership with people of making the it. So if you're doing a study in a you know in a community where the maybe for example in the UK you're doing a study in a community where maybe most of about 80% of the people don't really speak you know good English are of a certain culture. You should be able to open up to be able to accommodate these section of people. And mind you, remember if you have to translate, if there's a need for a translator, if there needs for a translation of whatever things you work with, that should be able to be, you know, that should be provided to make that kind of relationship work. The needs of the community is a way to kind of fuel their needs for them to be able to partake in the study. Um, is there any way you can help with regards to, how the is there any way they can help with regards to how the study is being structured, how things are being done, and all of that. So inclusive opportunity, by opening up for people you know diverse backgrounds or culture or community to be a part of that something big, and of whatever you are undertaking or whatever study you're doing, then obviously you're giving them that opportunity for their voice to be heard. Okay, so the whole idea is to get them involved so that they can be able to contribute, their voices heard, they can be able to contribute to the study, to be able to deliver what it's supposed to deliver. Okay, so inclusive opportunity, accessibility is very, very important. Making it open for people of whatever background with which you plan on undertaking the study on are able to be involved, to be able to air their views, to be able to help deliver the research in that manner which is going to be acceptable by the people you plan on studying. Okay, we talk about impact, seek improvement by identifying and sharing the difference that public involvement makes to research. Okay, so when it is more to do with how can we make the study impactful, okay, and involving the public, getting their views, understanding their perspective will help make the study you have undertaken receptive by the people you plan on doing the study on. And by the time the study is done, when the study gets to them, they feel a part of that. Even if they were not part of the study, when it gets to them, the study makes meaning to them, because there's some element of something that those who probably were part of the study have shared, which has made it a bit more relatable to them. And so they're able to, you know, be receptive to the impact. They use the impact. And even sometimes the people you use make it easier when it comes to sharing or disseminating the information. And by that, people relate to that. And so it makes the research impact. They're able to use the study, and, they use the study in a way that is understandable. Governance. So like I said, involving the public in governance is also necessary. It's not just asking for their views and stuff. We talk about actively involving them. So it could be in governance. It could be with regards to formulating the patient information sheet. It could be with regards to framing the topic or the objective of the study and all of that. So the perspective comes in different forms. So, but they need to be involved in the management, the leadership, the decision making, and the regulation. And that's something, we need to think about when it comes to public involvement in research. Support and learning. So remember, if you're using lay people or the public, and maybe you're doing a study about a scientific study about maybe incentives parametry, and you're using big scientific terms. Remember, you might have to obviously choose your words well for people to choose your words well to make it a bit more understanding. But then you also have got to train and support these people to be able to be of much help. Okay. And in that way, by supporting them, they learn from it. You also learn from them. Okay. And you learn from each other, and in that way, you can be able to support each other. So these standards, obviously, they enhance, consistency and uniformity when it comes to the quality of public involvement in research in the UK. So I'll briefly touch on what is public involvement, public participation, and public engagement. So, involvement, we talked about, is where the people are actively involved in the study, in the research organization. They are part of the governance board, decision making, regulation. They give their views. They help you on how to even write up the full study, for people to understand. And they even help you to kind of identify things you as a researcher would not have identified. For example, if you're going to be working with, patients with maybe biventricular assist devices, these patients, like I said, have been on the maybe might have been on the hospital for in months, and sometimes it just, you know, it can be a bit psychological, and even the approach to go to them, you might not really have thought about it, but the public involvement will be able to get that out, and that you might be able to have to involve the psychology or the psychiatry team to be able to help you navigate your way through this. And so it's very important. And honestly, when we talk about public involvement in research, people, when you think about it, unless maybe some have got bad experience when it comes to research, people are willing to offer their support when it comes to research. Some people are just passionate about the topic you're investigating in. Some people just want to give back to the society. We're in the NHS, where people get free healthcare, and sometimes, well, sort of a free healthcare, where some people end up in hospital for a year or over and they don't pay anything. And so by the time they are well and they go home, they feel like they have to give back. Some people just do it voluntarily. Some people just want to be a voice to the voiceless. They've been in a condition which maybe they've been in a community where they feel they're not heard. And so when they're given that opportunity, they want to utilize that opportunity to make that condition, known, or try and help the service providers to be able to provide the care they feel that's lacking. And so people just want to help. So that's the thing, that's the sense of public involvement. People are willing to help, and we as researchers, we need their help. And so by merging that kind of the need for help and wanting to help, and merging that and working together, and you know um bringing out studies that will make an impact to the health of the population. And you never know, you might be the one at the receiving end. And so it's something that we need to think about. When we talk about participation, where people take part in research study. So with participation, they could be passively involved in the study, maybe recruiting participants, for the study. They are part of the study. They take part of the study, I mean, but they are not actively involved in the study. So that's the difference. So participation and engagement, I explained before, can be part of a public involvement, but there are differences. Engagement, which is sharing of information and knowledge about the research to the public, obviously it is part of public involvement. But engaging in research does not necessarily mean public involvement. Research engagement is very, very important anyway. But when we talk about public involvement, it is more than just engaging in research. And so, thank you so much for today. Looking forward to our next session. And please, please, please like, subscribe, and share. And thank you.